Okay, guys, so in this lecture, we are going to talk about the production of erythrocytes. Erythrocytes are the red blood cells. We've talked a bit on erythrocytes in the previous lectures. You can take a look at that lecture given in the description. I've given the link to that lecture in the description before viewing this lecture, okay, because both of them are linked together. Okay, so now, uh, well, production of erythrocytes. What are erythrocytes? I told you that they are red blood cells, the most abundant single cell type found in the body, around 25 trillion, and found in the blood, going roaming around in the blood. Now, there are three stages in which erythrocytes are produced at different times of life. At different stages of life, they are produced by one part, by one tissue, by other organs, other tissues, and there are basically three different parts of the body where the erythrocytes are produced at different times of life. Now, let's start out with the earliest stages of life in the intrauterine life before birth in the first trimester of pregnancy, basically during the first 3 months, around the first 3 months of pregnancy, we have nucleated RBCs which are produced by in the yolk sac. Nucleated RBCs are produced during the first trimester of pregnancy in the yolk sac. So this is the first stage of RBC production. Nucleated RBCs in the yolk sac before pregnancy during the first trimester of pregnancy. Then the second stage is during the middle trimester when the next 3 months, basically the middle trimester, in which you have they are made mainly this role of producing RBCs is taken up by the liver. Okay, liver produces most of the RBCs during this stage, and to some extent, in addition to liver, we have the spleen and lymph nodes also producing RBCs, but it is mainly the liver that produces the red blood cells. Okay, and these are the two stages. Now, the third and the final stage, after which the red blood cell production starts. Basically, it has begun from these stages as well. It has begun in different parts of the body, but like this is the stage where this is the part of the body where it will stay. This is the part of the body that will continue producing red blood cells throughout life. Okay, and it starts out during the last month of gestation, basically a month before, approximately a month before birth, and immediately after birth as well. So it starts out before birth, a month before birth, and continues throughout life. These are exclusively made in the bone marrow. Bone marrow is the part where the red blood cell production then takes place, which is found inside the bones. Bone marrow is found inside the bones. Okay, we have two types of bone marrows in our body. We have the red bone marrow and the yellow bone marrow. It's actually the red bone marrow that is hematopoietic. Hematopoietic means capable of producing the blood cells. So it is the red bone marrow that produces the red blood cells. As time progresses, most of the red bone marrow in different parts of the body, in different bones of the body, I should say, gets replaced by the yellow bone marrow. Yellow bone marrow is a fatty bone marrow. It is fatty and it is non hematopoietic. It is unable to produce red blood cells. So it's actually the red bone marrow that is the red blood cell producing bone marrow, not the yellow bone marrow. Now, what happens is that when a person is born at around and as he grows, so till the age of approximately 5 years, almost all the bones of the body contain red bone marrow. Okay, contain red bone marrow. That's why it is capable of producing red blood cells. So around 5 years, all the bones, the bone marrow and all the bones of the body is capable of producing red blood cells. But after a person approaches in a later age of approximately 20 years, most, with an exception of a few bones, most of the bones lose their red bone marrow, and that red bone marrow gets replaced with yellow bone marrow. Okay, and I've given the exceptions. The bones which are in which the red bone marrow persists are the basically the proximal portions of the tibia and the humeri. Humeri is plural for humerus, tibiae is plural for tibia. Um, okay, the proximal regions only, okay, not the entire tibia and not the entire humerus. but just the proximal portions of these two bones, they contain red bone marrow and it remains red and is capable of producing the red blood cells, whereas the bone marrow present in the shaft, it gets replaced with the fatty yellow bone marrow. Okay, yeah, this is done. Right now, let's come down and look at these few diagrams and a bit of information that I've given down here and in examples of there are a few bones that in which the red bone marrow persists throughout life and which that bone marrow is responsible for RBC production throughout life, and now we are going to look at that. Now, first of all, I told you that the TB, the proximal part of the humerus, the proximal part of the humeri and tibiae produce red blood cell, have the red bone marrow throughout life. Okay, the proximal part. Okay, this is our humerus over here in the arm. Okay, the humerus contain three regions basically. Uh, these two regions are known as the epiphysis. This is something you've done in your gross anatomy. Epiphysis and the middle portion, epiphysis, and this middle portion is called the diaphysis, the shaft, or it's also called the shaft of the bone. Okay, now what happens is that initially when a person is born, this entire bone is filled with red bone marrow. Then as the life progresses, the red bone marrow in most of its region gets replaced with yellow bone marrow that is non-hematopoietic in the diaphysis as well. Okay. Then in the proximal epiphysis, meaning the proximal part of this bone. Proximal is that region, that part of the bone which is close to the point of attachment. This ball and socket joint of the shoulder is the point of attachment for this humerus. So now this part is this pole, I should say, this end of the bone which is close to this point of attachment. This part contains the red bone marrow, and this is the proximal part. Whereas the other part, which is away, the other extreme of the bone, which is away from the point of attachment, is called the distal part, and the distal epiphysis, I should rather say. Okay, so bone marrow over here persists for a longer period of time and it continues producing the red blood cells. Now, there are a few bones, as I told you, which have the red bone marrow throughout life, and they continue producing red bone marrow throughout life. This red bone marrow is not replaced by the yellow bone marrow. Okay. Now, those bones which are the membranous bones. Okay, what are membranous bones? Membranous bones are those bones which are produced by intramembranous ossification. Intramembranous ossification, we'll make it's something you've done in histology, in gross anatomy as well, but I'll just give you a brief overview of what that is. Intramembranous ossification is the bone formation in which mesenchymal stem cells condense to form bones. Okay, and examples include the vertebra, the sternum, the flat bones of the skull, and the iliac bones. These are all membranous bones, and these bones contain the red bone marrow. I have labeled them on this diagram over here with red. Okay, this is the vertebra. Then you have the ribs, which contains the red bone marrow. You have the sternum. This is the sternum, the middle portion, the median sternum, which is right lying along the median plane. The sternum and the vertebra, they both contain red bone marrow, and the ribs contain red bone marrow. Okay, these are the major red bone marrow produce containing regions, bones, and this the pelvis. Pelvis also contains red bone marrow. To be more specific, it's the iliac bones of the pelvis. The iliac pelvic bones contain red bone marrow, so they are capable of producing red blood cells. Okay, and these are the portions where the red bone marrow persists throughout life. Okay, one thing I forgot to tell you over here, and yeah, the proximal part of the tibia is gonna be this above the upper part, which is close to the knee joint. The knee joint is the point of attachment for the tibia, so it's the proximal part. Now, one thing I would like to discuss before proceeding forward. Okay, these proximal parts of the long bones, just assume this to be your long bone. Oh, sorry. I'll make a diagram of the long bone. Okay, assume this to be your long bone. The proximal part of the long bone contains the spongy bone, as you guys are already familiar with. This spongy bone contains plates of bones called the trabeculi, and these plates of bones, the trabeculi, contain spaces in between them. Spaces between them, and it is these spaces which contain the red bone marrow. Contain red bone marrow. Okay. Now this diagram over here. Okay, this diagram is basically shows the relative rates of the red blood cell production in the bone marrow of different bones at different ages. Okay, the x-axis is labeled with the age, and y-axis is labeled with the cellularity or the percentage of red blood cell production or percentage of cell production as a whole. Now the tibia, the femur, the ribs, sternum, and vertebra. I told you the ribs, sternum, and vertebra they contain the red bone marrow throughout life, and so if they contain the red bone marrow, this red bone marrow will not be replaced by the yellow bone marrow. I told you that as well. These are the membranous bones produced by intramembranous ossification. Now, this red bone marrow is produces red blood cells throughout life, and therefore their rate of producing red blood cells decreases very, very slowly. Okay, they are still above the zero axis for a longer period of time. Look at the age, it's approximately 70 years, and even at 70 age of 70, the ribs, sternum, and vertebra are producing red blood cells. Whereas if you look at the shaft of tibia and femur, shaft is the middle portion, as I told you guys earlier, the middle portion of the long bone. Okay, the shaft contains red bone marrow initially, but this red bone marrow gets replaced by the yellow bone marrow, which is not capable of producing red blood cells. So that's why the cellularity around the age of 20 years, 20 to 25 years, gets diminished. The cellularity approaches zero, and so they are not able to produce red blood cells. Yeah, but the proximal portion of the tibia and the proximal portion of the humerus, they are still capable of producing red blood cells because they contain the red bone marrow. Okay, so this was your chart. Okay, now a piece of information for you guys, which I would suggest you guys should learn. These are basically the concentrations of red blood cells in males and females and the amount of hemoglobin in males and females, their relative values. Okay, by the way, I'm pretty much sure that you guys are familiar with the hemoglobin. Hemoglobin is basically a protein uh, which is the main carrier of oxygen, a quaternary structured protein present inside the red blood cell, and that is capable of binding reversibly with the oxygen. So it binds with oxygen in the lungs, and then it can dissociate from oxygen at the tissue level to provide the tissues with oxygen. Anyways, we've talked about hemoglobin in the previous lecture. I've given the link in the description as well for this part as well for the hemoglobin. So do check that out. And we are going to talk about the hemoglobin in a bit more detail in the upcoming lectures as well. And I've given that, I'll give the link of that lecture as well in the description. Now, concentration of RBCs in men, we have 5,200,000 per millimeter cube of blood. Right, in women we have lesser RBCs. We have 4,700,000 per millimeter cube of blood. Okay, RBCs contain this hemoglobin. Okay, let's look at the hemoglobin values as well. If we compare 100 ml of blood of males and females, males would contain 15 gram of hemoglobin on average, and females contain 14 grams of hemoglobin on average. And each gram of hemoglobin can transport 1.34 ml of oxygen. So this means that each 100 ml of blood of males can transport around 20 ml of oxygen, because if you'll multiply 15 by 1.34, you'll get an answer approximately close to 20 years. Sorry, 20 ml. And for females, if we multiply 14 by 1.34, the 100 ml of blood of females can transport 19 ml of oxygen. Okay, guys, so that's it. Thank you so much. And I'll in the next lecture, we'll be doing the erythrocyte maturation of erythrocytes. Okay, a very important lecture, so please do check that out as well. I'll give the link to that lecture as well in the description.